Thanks, Hendricks. As the forum members met to continue to consider the topics for this workshop, we recognize that promoting the cognitive, affective, and behavioral development and well-being of children begins at home. I was reminded of that 5 weeks ago when my son and his wife had their first baby, my first grandson, Tennessee Hawkins. While the structures of families raising children in America continues to change and evolve, the adult caretakers who raise children, mothers, fathers, adoptive, biological, grandparents, other relatives, foster parents, those people continue to play the primary role in ensuring children's successful development and well-being. In this workshop, when we use the words parents and families, we'll be referring to adults who are raising children, regardless of the structure of the household or the biological connection between the adult caretakers and the children they're raising. The last 3 decades have seen remarkable progress in the development of promotive and protective and preventive interventions proven in rigorous research to help parents, adults who are raising children, to provide the nurture, the guidelines, the monitoring, and the reinforcement needed to ensure that children and youth develop successfully and thrive. Effective parent and family-focused preventive interventions have reduced known risk for negative developmental outcomes and promoted behavioral health from conception through adolescence. These include effective universal preventive interventions for all adults raising children provided at key developmental points in the trajectory, like birthing classes for expectant parents and workshops for families whose children are entering adolescence. They include selective preventive interventions for those whose children are at risk of negative developmental outcomes, such as nurse home visiting for single teens and women from poverty about to have their first baby. And they include indicated preventive interventions in early childhood for parents whose children are engaged in oppositional or aggressive behaviors. They include family-focused interventions for vulnerable populations, including minority and immigrant families. We will learn that a number of these preventive interventions have been subjected to rigorous benefit-cost analyses and found to produce benefits to children in society that far outweigh their costs. Yet today in America, few of these effective family-focused preventive interventions are reaching all or even a significant proportion of the parents and families who need them. We have made big progress in identifying what works to empower families to ensure the successful development of children, but we have not ensured that all families have access to these preventive interventions. This workshop addresses this question: how could we ensure that all families who need tools, skills, and support to assure the successful cognitive, affective, and behavioral development of the children they are raising have access to those skills and supports? As you can see from the workshop agenda, the answer to that question raises many related questions. How can we make available proven effective family and parent-focused preventive interventions at scale with implementation fidelity? What is the role of states, the federal government, advocacy, and capacity-building organizations in this regard? How can the scale-up of effective parent and family-focused preventive interventions be funded? How can busy adults whose children and families would benefit from those interventions be motivated to find the time and overcome the many barriers to participation? What new strategies for reaching parents and families are needed? We will address these questions and more over the next day and a half. We will explore ideas, progress, and directions for the way forward. We have designed the workshop to provide opportunities for all participants to share thoughts and questions following each set of presentations. So it's time to begin. And our first speaker this morning is Lauren Suppley. She's the Director of the Division of Family Strengthening in the Office of Planning, Research, and Evaluation for the Administration for Children, Youth, and Families. This new division within OPRE includes work related to healthy marriage, responsible fatherhood, youth development, teen pregnancy prevention, early childhood home visiting, and domestic violence. It's a big portfolio. Prior to this position, she was in charge of projects such as the Head Start Cares, the national group randomized evaluation trial of evidence-based social emotional promotion programs in Head Start classrooms, home visiting evidence of effectiveness, a transparent systematic review of evidence on home visitation programs, mothers and infants home visiting program evaluation, a congressionally mandated national evaluation of the new maternal infant and early childhood home visiting program, and the Strong Start, an expansion of My Hope to examine home visiting and birth outcomes. She also leads the federal interagency work group on research on evidence-based policies and practices. In sum, Lauren Suppley is perhaps the person most centrally involved in the development and rigorous evaluation of the federal government's current efforts to scale effective family-focused preventive interventions. We are honored that she is here to provide the initial keynote for this workshop. Lauren.